So hi, everyone. Thank you for joining us today. We're happy to have you here with today's Lunch and Learn titled Best Practices in Community Education and Dental Partnership. We have a number of speakers lined up, including Kristen Hoft, Anthony Eleftherian, some LOHP panelists from Marin, Shasta, and Sutter counties. And we have Cindy Smith and Amina Jones from Medi-Cal Dental Outreach joining us today. Just a couple of housekeeping items. I think most of you have been here with us before, but just so you know, the meeting is being recorded and will be posted on the COTAC website and YouTube channel. We'll also be following up afterward with an email to all of you with the link so you can record or view the recording afterward. And any other meeting materials will be sent then too. If you have questions, please go ahead and pop them into the chat box. And we will be keeping track of them and we'll answer them toward the end of today's presentation. And we just ask you all to stay muted until we have that open forum. If you have other comments, if you have resources that you want to share, if you want to have any other kinds of discussion, that's also welcomed in the chat. So feel free. And then at the very end, we'll do an evaluation poll. So we appreciate you staying on and providing some feedback to us so we can continue to make these Lunch and Learns even better for you. So our objectives today, these are part of the Zoom registration link. So I think you should have seen these already, but there are 4 of them. The first is to recognize how health literacy and cultural humility can improve health equity. The second is to talk about the California Oral Health Literacy Toolkit and how to access it on the COTAC website. The third is to use evidence-based communication techniques in community education. And the fourth is to understand some best practices when creating partnerships with dental practices. You see our agenda on the right. So Anthony will kick us off, and then Kristen, and then we'll have a panel discussion. And then Medi-Cal Dental Outreach will provide some information, and then Anthony will end on oral health communication. Then we'll have Q&A. So before we get started, I'm going to go ahead and introduce today's 2 main speakers, Anthony Eleftherian and Kristen Hoft. So Anthony is a writer and the Director of Communications at Health Research for Action at UC Berkeley. And Kristen is an assistant professor in the Department of Preventive and Restorative Dental Sciences at the UCSF School of Dentistry and is the director of COTAC. So Kristen will be introducing the other speakers later on, but you can read more about everybody in the link that I'm popping in the chat right now. There we go. So Kristen and Anthony, I think I will turn it over to you now.
All right. Thanks, Aubrey. Welcome, everybody. We're going to start with Anthony as the speaker. I'll just mention that we don't have any conflicts of interest to disclose. There we go.
Great. Well, hi, everyone. I'm Anthony Eleftherian, Director of Communications at HRA at UC Berkeley. As you know, we're going to talk today about oral health literacy, the concept of which has been around since the 90s, or at least health literacy in general has been. And it's gone through several definitions in all that time. The most common, if you go to the next slide, the most common concerns individuals. And it states that health literacy is a person's ability to find, understand, evaluate, and use health information. This ability extends to the confidence to advocate for one's needs in healthcare settings. Of course, this ability is also affected by many factors. So education, cognitive abilities, experience with health conditions, and healthcare medications, et cetera. But it's also affected by interactions with doctors, nurses, pharmacists, and other healthcare personnel. And by the features of healthcare environments, such as signage, helpfulness of personnel, and that sort of thing. And that leads us to the next component of the definition, and that's the health literacy of healthcare professionals, meaning anyone who helps someone understand their own health. So a healthcare professional can be health literate in many ways. For example, a dentist or a dental hygienist can be health literate simply by evaluating their care environment from a patient's viewpoint and presenting health information in ways that make it easy to understand and act on. And health literate professionals, also might aim to lower barriers to communication and understanding, reduce feelings of fear and shame, and using empathy while helping patients consider and adopt health promoting behaviors. And of course, this definition sort of goes on, it keeps building over the years and extends to organizations and societies as a whole, which, when they're health literate, likewise provide kind of shame-free and equal access to healthcare and health information. Next slide, please. So we explain a little bit about, kind of conceptually what health literacy is, but why is it important? What makes it particularly significant? And for one thing, and it's probably the most important thing, literacy is the single best predictor of a person's health status and correlates more closely than age, income, employment status, education level, or racial or ethnic group. And furthermore, we know that 2/3 of US adults lack understanding of health information, and many only understand the most basic of health information. Next slide, please. So to dig a little deeper into the health literacy of US adults, we know from the National Assessment of Adult Literacy that 93 million US adults, have basic or below basic health literacy skills. And as an example of what that means, 93 million adults in the US can't use a bus schedule or read a set of short instructions and identify what is permissible to drink before medical tests. So limited or inadequate health literacy also appears to significantly affect groups who have experienced greater obstacles to care based on their age, income, and education level, racial or ethnic group, gender, or other characteristics historically linked to discrimination, such as geographic location, culture, and language. As you can see just from the screen here, these are the same social determinants that drive other health disparities. And while there are obviously systemic changes needed to reduce those disparities on a large scale, there's a lot we can do via verbal and written communication to improve the oral health literacy of our communities and help make sure they get the oral health care they need. Next slide, please. So for oral health patients, good oral health literacy correlates to a number of improvements in their life. It lowers the rate of dental caries and periodontal disease, increases the use of preventative dental services. It also means better participation in their own care and an increased likelihood of getting the care they need. So in a way, we could think of oral health literacy as a tool to help create more equity inside of health communication. So by removing at least some of the barriers to understanding and acting on health information, which stem from the social environments where people are born and live, we can help empower people to care for themselves. So though we've been discussing these factors that influence health literacy in the groups most commonly affected by limited health literacy skills, it's also important to point out, I'm sure many have heard this, that one can not tell someone's literacy level simply by looking at them, right? Indeed, someone might express themselves very well, appear to understand, and still not completely comprehend the health info that they've been presented with. So, if you remember the statistics we mentioned earlier, 2/3 of US adults don't have proficient health literacy. And most people read several grades lower than their last grade of school completed. So that alone suggests that it's not only true that anyone can have limited oral health literacy, but that the vast majority of us do, including all of us here in this room or in this virtual room. So consider what people experience during a health situation, right? Fear, stress, anxiety, unfamiliar words, difficult subjects, not always friendly environments, etc. And in that environment or in that situation, even highly literate, medically informed people tend to not be as present and comprehending when dealing with any of these issues. These are just some of the reasons why OHL, health literacy in general, is very important to improving the lives of community members. And a little bit later in the presentation, I'm going to get into some ways in which we can improve understanding around oral communication via health literacy strategies. But right now I'm going to turn it over to Kristen to talk a little bit about our oral health literacy toolkit.
Thanks, Anthony. So I hope you guys, you now have a little bit of the understanding of what is oral health literacy and why is it so important. And so one of the things that we have done, understanding how important it is with the State of California Office of Oral Health, we have created the Oral Health Literacy Toolkit. There you go. All right. And so as understanding how important health literacy is and that the providers throughout California, as well as all of the California's population, needs help to improve their communication so that everyone can have successful encounters in dental office and successful communication. So this oral health literacy toolkit was developed. We went through a pretty lengthy process in terms of exploring all of the existing materials, talking with dental providers throughout the state of California, and pilot testing all of the components of it with a wide range of providers, as well as different patient groups or community member groups, to make sure that everything in here is easy to use and met the needs and priorities of the stakeholders. So I'm just going to talk through a few pieces of the oral health literacy toolkit and tell you where you can find it. Some of you may have used parts of it before. This first part is the oral health literacy toolkit booklet. And you can get it on the website. And some of the things that the toolkit covers generally are basic oral health literacy principles, including clear communication and cultural humility, which Anthony is going to talk about more later in today's presentation. How to create a shame-free and fear-free environment, understanding more about how oral health literacy affects patients, and the need to arrange language services. So the first piece is this guidebook. The front cover was just on the last slide. And this guidebook helps providers, which was initially for dental providers, but it can really be used more broadly with anyone who needs to communicate. And it helps you connect better with patients and understand their needs, implement health literacy at every touch point of the patient visit. It really breaks things down in easy to follow way. So you make sure that you're doing a comprehensive change to your communication style. And it's sort of at your own pace. So if dental providers are implementing in the practice, or if you're implementing it in some of your LOHP education, you set your own goals and your own pace. So you can sort of choose to take on as much as fits your current agenda or your current capacity. Another piece in here is the practice assessment. And this is an assessment checklist to look at dental practices to see how accessible is it. Are we doing a good job making sure that our signs are easy to read and understand for the patient population that we serve? How is it when you make a phone call? Is your office easy to find? When you come into the office, is it welcoming and inviting for people of all abilities and backgrounds? And it's an easy checklist to go through, and it helps you think of things comprehensively to understand some areas that the dental practice could improve to make it more welcoming and inviting to its patients. And this is something that we encourage dental practices to undertake, but it's also a really great tool to use to partner with your dental practices. If you have LOHP, it's a good thing that your LOHP staff could work with dental practices to offer to help them to conduct the practice assessment. Sometimes people who work at LOHPs have a better understanding of what the community needs are. Since you're out working with the community more often, you might bring an additional perspective than a dental provider filling out this checklist. So you could have the dental practice fill out the checklist, some people from their staff, but also you guys could fill one out and then you could discuss it. We also have a teach back booklet, and this is something that Anthony is going to go over more later as well. But one of the main things that we advocate in the oral health literacy toolkit is using this technique of teach back. And so this teach back booklet helps you understand how to do teach back, and it has a lot of examples of how to use easy ways to use teach backs and ways for you to practice your skills. And the Teach Back booklet is also available in Spanish. So if you have Spanish speakers in your area, can use this as well. And we have an action plan. So this is part of the way that you can go through the toolkit at your own pace or work with a dental practice for them to go through their own pace. And I'll point out that it's a way for people to choose their goals and record their goals and action items, and it matches the rest of the guidebook. And I'll mention that LOHP objective 5.2a is to come up with an action plan for making sure you have oral health literacy or health literate health workforce. And so this is a tool that maps directly to your work plan objectives. We also have a patient resource, and this is a really great introductory resource to what happens at the dental office. It's called Going to the Dentist. We have it available in English and Spanish, and it explains the before, during, and after of dental visits. It helps new patients know what to expect and how to prepare for a dental visit. So it's available on the website. You can download and print it for free. And it might be a good tool for some of your outreach events. And we have it in Spanish as well. And to access the toolkit, I put a QR code here to the website, but you all have probably also seen it on COTAC's website. It's in our banner at the top, and you can go to this website to get it. Just some tips of thinking about supporting community and dental practices in your community with the toolkit. Some things you can do are offering to conduct health literacy assessment of the dental office using that assessment tool I just showed you. You can provide free Spanish language material like that Going to the Dentist brochure. Improve provider communication techniques and patient understanding. By using these tools, providers can improve their communication techniques and understanding. And it's also a great resource for your own team to improve your team's communication skills. A lot of people are out doing community outreach and education, and using something like Teach Back in those encounters can really improve the impact that you have. If you're thinking of partnering with dental offices to implement the toolkit, you can ask dental offices if they're aware of the toolkit, if they have an oral health literacy champion, if they've done that assessment, if they practiced that assessment for oral health literacy. And you can explain to them the importance of oral health literacy, how it increases patient loyalty, it decreases miscommunication, it can be implemented on the practice's timeline, and emphasize that it allows practices to assess their oral health literacy readiness, improve provider-patient communication, and improve safety, right? If patients are able to follow instructions more accurately. And you can also follow up. So there's additional resources that you can offer as well, some of which I'm going to go over after the panel presentation. So the initial vision of the Oral Health Literacy Toolkit was to have LOHPs out on the ground, raising awareness of dental providers in their counties about oral health literacy and encouraging their use of the toolkit. However, we know that getting attention from dental providers is a real challenge, especially during COVID and even now after COVID. And we know that LOHPs have many competing priorities for dental providers once you do get their attention. So I wanted to spend, and we know from your needs assessment survey that you took from us that dental partnerships are, always difficult. So we wanted to spend a little bit of time talking about creating dental partnerships and some lessons learned from some LOHPs who were willing to share. So I first want to acknowledge that we know how challenging it is. Everybody is LOHPs are sometimes understaffed, dental offices are often short-staffed, and that patient dental need is really high after COVID. So we know that the setting that we're going into when we're approaching dentists to create partnerships is stressful, and everybody feels really stretched right now. So we acknowledge it could be a bumpy road, but dental partnerships can really be beneficial to both LOHPs and the dental practices. And so we've invited 3 LOHPs to discuss some of their dental partnerships, some of their processes and successes and tips, just to help give you some more real life examples of how they have been successful in creating and sustaining dental partnerships, and maybe give you guys some ideas on how else you can kind of keep chipping away at this challenge to create dental partnerships. So I'm happy to introduce our LOHP speakers today. We have, all right, so returning to the panel discussion, and we have our LOHP panelists who will speak to their experiences in building and sustaining relationships with dental providers in their counties. From Marin County Health and Human Services Agency, we have Danica Ng and Syra Soriano. Danica is the senior program coordinator, and Syra is the program coordinator for their LOHP. From Shasta County Health and Human Services Agency, we have Aya Ali, who is the program director of Shasta's LOHP. And from Sutter County Public Health, we have Ritu Sierra and Christina Vang, both of whom are health program specialists for their LOHP. I want to thank them very much for joining this panel. And then let's see if I can go through. All right. So we're going to go through and discuss some of the dental partnerships that they have, and they'll be able to speak about who their partners are, how they created and sustained those partners, and just some of the highlights that they wanted to share with other LHPs. So first, we're going to talk about FQHCs, and I'm going to invite Marin LOHP to share first.
Hello, my name is Syra Soriano. Thank you so much for inviting us to speak today. Just want to talk a little bit about our partnerships with our local federally qualified health centers, as well as our dental society. So I'll speak about our FQHCs for short. We have 3 identified as our strong partners in our county, and those 3 are Marin Community Clinics, Marin City Health and Wellness Center, as well as Petaluma Health Center, which serves part of our county as well. And so our federally qualified health centers have been strong partners for our local oral health program prevention and intervention work. They have supported us in an array of different outreach and prevention work. And the way that we have done that is by connecting with the dental directors from those FQHCs. We've invited them to be a part of our advisory committee. And so they serve as active members, giving us feedback about their insights with the dental services that they've been providing their community, the needs identified, and they help provide feedback for us, especially with our community needs assessment that has been extremely vital. And other ways that we have partnered with them is in our dental screenings that we've been doing with our schools for the school-based schooling program and the care coordination process as well. And so that is servicing young children, but also families as well. So really being able to be transparent with us about their capacity to support our projects and support the dental needs of our community has been really helpful as well. They've also helped us with our community events, such as trainings and presentations that we've done. They serve as content experts for those, and trainers, special event speakers, and doing a lot of work and support for us as we try to reach as many community members as possible in Marin County. And also they've helped provide contact expertise and literacy support in our messaging development for our messaging and our media. And so the way that we've done that has been through social media as an example, and they've helped us craft messages in those avenues, but also they've been really helpful for a 4-minute video that we developed in our previous grant cycle that really is supposed to be friendly for all age ranges. But it's an animated video, which our dental centers can show in their offices, that is kid friendly, but also has a lot of messaging for parents and adults, general population. I'll pass it on to Danica to talk about the Dental Society partnership.
Yeah, so our dental society partnership. So we have one main dental society in Marin County, and that's the Marin County Dental Society. But we do have kind of a reserve corp of medical providers that we also tap into, that they're very kind of dental society like, and that's the Marin County Medical Reserve Corps. So our dental society is really our connection to the private practicing dentists in our county. So the executive director sits on our advisory committee and really keeps us informed of things that are going on, initiatives, activities from the dental society, but also they support us by sharing out information and helping us develop any type of messaging with information on oral health literacy. So keeping in mind accessible language for our community and our populations. So they help us to develop this message, but they also help disseminate the messages. So any information and communication that comes out of our office, we send to the executive director, and she sends it out to all the private practicing doctors in her network, which right now is about 218. So there is quite a bit of reach through the dental society that we can partner with. In addition to that, with the MMRC group, this is a new group that we are working to partner with, but they
Can you tell us what
sorry.
MMRC is?
Oh, I apologize. MMRC is the Marin County Medical Reserve Corps. So it is a group of retired medical and dental practitioners that keep up an active license, but they no longer have a brick and mortar shop. I apologize. I always think MMRC people know that, and I'm like, nope, not everyone's from Marin County. But it really is a volunteer group of just active providers that are just looking for community initiatives to be a part of. So they're typically activated in emergency situations, but they're program coordinator for their program. We've invited to sit on our advisory committee as well. So we have a pipeline to them, and they are very much on board with any type of volunteer opportunities. So they will soon be partnering us with schooling screenings as providing experts. Their nurses will also be likely tapped to help us scribe for information. I imagine in the future too, we could also partner with sharing out information as well as developing messages. But they've also are helping us with supplies too as well. So they are working on getting us dental kits so that we can distribute at our school-based screening, so that we can give some preventive materials to take home for at-risk students as well. So it's not necessarily a dental society per se, but in a way it is a bit of a society where it's a cohort of private practicing dentists that we can tap in and get their support from. So a lot of great support as well coming in from our dental society groups in Marin County.
Great, thank you. I wanted to invite Sutter to speak next. You can start talking about your partnership with FQHCs.
Hello, everyone. My name is Riti Sira, and I am the Oral Health Project Director for Sutter County Public Health. Today, I'll be sharing a little bit about my team's experience building partnerships in our county. In our county, we have 3 different types of interactions with our partners in the dental field. We work closely with our FQHCs, our dental offices, and a contracted dental hygienist through First 5. Some of the ways that we partner include community events, dental screenings, and the Sutter Yuba Bi-County Oral Health Advisory Committee. And one of our partnering FQHCs has an approved MOU in place to start COA screenings at 3 pilot schools this coming fall. So we're super excited about that. Our participating FQHCs, which there's 2, there's Peachtree Health and Ampla Health, which both of them have integrated dental clinics. And Peachtree is who we are actually doing the approved MOU with. And then our other Ampla Health is also a part of our OHAC, and both of these FQHCs bring their expertise while planning community events, and then also just discussion at the table. Sorry, did you want me to go into like the dental clinics and then RDH as well?
I think, yeah,
Okay.
We'll change the order, yeah, so we can just go through all your partners. That'd be
Okay,
great.
perfect. So
Thank you.
we also work with our RDH, and this is through a partnership with Verse 5. We collaborate with them during their Help Me Grow Sutter events. So during these monthly events, we provide the participants with oral health education and resources. And then while the dental hygienist conducts the oral health screenings and the COAs for those that qualify. So these events are actually really fun. We get a chance to, work with the younger age group, the 0 to 5, and then talk to new moms and, moms that have older kids too. And then our collaborations with our dental clinics is that they also participate in our yearly National Tooth Fairy Day Health Fair, which is a planned and implemented through our Oral Health Advisory Committee, which, by the way, is bi-county with Yuba County. And for the last 3 years, we've hosted this event in hopes to collaborate on something that we can call our own. And this basically is a great opportunity for our wonderful team to do an event together that we plan and implement. All of our members help plan this event and help choose like what they will like to bring to our residents each year. So this year, for example, we're having 5 dental offices that'll be present to educate the community on topics such as 2x2x2 rule, sealants, fluoride, toothbrushing, and flossing demos, along with other important partners such as eligibility offices, our local our tobacco control program, our CalFresh Healthy Living program, and we would also like to invite our Smile California team, who's actively participating in our Oral Health Advisory Committee. Through this partnership and collaboration, our dental experts can help provide the expertise and knowledge to our residents. We establish strong partnerships with our dental clinics by meeting with our dental providers at least 4 to 5 times a year. By doing dental provider visits, we were able to create relationships with our dental office staff. So some of the things that we do during these visits are actually like key informant interviews, focus groups, surveys, or like check-ins with them. We discuss COA information, any upcoming community events, and give them flyers to hand out. We also give them any updated materials and resources that they can fill in their portable oral health toolkits that we created for them, so that our providers can have materials, hands-on materials during appointments. This portable oral health kit is actually a portable file folder box that you might see in schools that teachers use. We really thought this was handy because it includes all oral health related materials covering topics such as 2x2, sealant, information fluoride, Smile California materials, tobacco cessation materials, as well as Rethink Your Drink materials, and many more. All 13 of our medical accepting providers have toolkits in their offices, and something that our dental office staffs really enjoyed that we did with them just recently is for Rethink Your Drink Day, we wanted to celebrate not only in the school settings, but with our dental clinics as well. And something that we did was each office was given a fruit-infused water pitcher and 5 different flavor recipe cards that the state gave us. And the dental offices were asked to choose a recipe of their choice and host their very own Rethink Your Drink event in their clinic. We asked them to send us pictures of their setups and that we're going to share at our next OHAC, which is so cute because they like literally went all out and put these cute little flamingo like what do they call straws and stuff like that. They really had a great time. So doing these kind of activities and collaborating and these collaboration efforts definitely increased within our partners and dental community. And this also helped us get more partners to participate in our events that we hold yearly. And some advice that we would give our LOHPs is that creating these kind of relationships and building these champions at each site is really important, not only for you to end up learning about each dental office and what services they have, but the amount of support you get from these dentists and their staff is really phenomenal, and they're really excited to get out in the community. So really take that advantage and make those relationships with your partners, because some of them really want to get out and be a part of the community and just be there with you and have fun at these events that you host. We really hope that this kind of gives you a little insight on ways that you can also build relationships within your county. Thank you.
Thank you. Thanks for sharing. Next, we have Aya Ali from Shasta. It's on mute.
All right. Hi, everyone. I'm Aya, and I'm from the Shasta County LOHP. So, Kristen, I just want to double check. So we're going through all of the different roles.
Yeah. So now if you could just talk about all your partners. Yeah. Thanks.
Good. Thank you so much. Starting with FQHCs, a few years ago, something that we did is we opened an RFP, or request for proposals, for providing funding for school-based preventive dental services. And through that, we were able to help an FQHC called Hill Country here in Shasta County. We were able to help with funding some mobile dental equipment that they can use in schools. And through that, they purchased that mobile dental equipment, and they've been able to use it in rural school sites and also at Head Start locations. So that has been super helpful for helping with dividing and conquering when it comes to preventive dental services, and also, for example, especially COHAs. So right now that we're going out and we're doing COHAs in schools, we can look at the schools that the Hill Country FQHC is not going to. So it kind of reduces the load of schools that we need to go to throughout the school year. Another thing is we have representatives from 2 FQHCs that are a part of our advisory committee. So through them, we're able to get some really good insight about what's happening in the community. And they also have some really good expertise to share when we do ask for their opinions on things. And now when it comes to private practices, as Kristen mentioned, through COVID, also post-COVID, it is tricky because their capacity is limited. So when Kristen, Aubrey, and I met earlier last week, how I described it was, you just need to plant the seed. So even if, for example, maybe they don't have the capacity to work with you to a certain extent, something that we have is we have an email list for all the private dentists in the community, for all the Medi-Cal dentists in the community. Whenever, for example, something like the oral health literacy toolkit comes out, we send it to them. We find out about an event happening, we forward that to him, a new resource, a website, anything like that. We make sure that we forward that to them just so that they continuously and regularly see the LOHP, our name, so that they have our contact information handy. We also have gone in person to these clinics when we were distributing the tobacco cessation materials and Rethink Your Drink materials. And as my fellow LOHPs mentioned earlier, going in person really helps develop relationships when you go to those dental clinics for distributing materials. Next, for dental societies, our advisory committee recommended for us to ask for our local dental society, which is the Northern California Dental Society. They recommended for us to ask to get on the agenda for their board meeting. So we did that, and we were able to get on their agenda. And through that, we were able to explain the presence of the LOHP, what our purpose is and our goals. And we were able to have specific asks at the end of that presentation. And it was really nice because it was more of an intimate meeting where we could get some feedback and the attention of those dental professionals. And hopefully that was a nice foundation to start a relationship moving forward with that dental society if we need to work together when it comes to future activities. The next thing is dental professional schools. So here in Shasta County, we have Shasta College, and in Shasta College, there is a dental hygiene program. And in an effort to expand like the expertise and the perspectives on our advisory committee, we invited one of the dental hygiene instructors to be a part of our advisory committee, and she accepted that invitation. And she later on, a few months later, she actually invited me to join their advisory committee for the dental hygiene program at Shasta College. So it was a nice like two-way exchange of our perspectives and their perspectives for both of our programs. And then the last thing for RDHAPs is we currently have a contract with an RDHAP to complete COHAs in schools. And this was our first school year that we worked with an RDHAP to do that. And if you don't already have an agreement like that in place, I highly recommend it because it really, really makes a big difference when you're able to have guaranteed times and days for an RDHAP to complete these assessments. And also it really builds that consistency throughout the school year, that relationship between the schools and the school nurses. So really it has been a really, really good experience. And also having the same dental professional going to the COHAs really helps when it comes to when you're improving the COHA experience and just trying to make it efficient while maintaining the same level of quality. Having the same dental professional there really has helped. So that has been our experience. Thank you.
Great. Thank you guys so much for sharing. I want to, at this time, I want to invite everyone who's attending the Lunch and Learn to share any questions that you have. Well, we have about 5 minutes to answer any questions. You can put them in the chat or unmute yourself. And while people are putting in their questions, we have a few here. I feel I'm going to jump to the second one about how do you maintain partnership. If anyone wants to jump in and just talk about any suggestions or techniques that have worked well to sort of keep up engagement when everyone is so busy. Go ahead, Dan.
I can jump in from Marin County. I think for us, especially since our dental providers are so busy, I think consistency is key. So we try to pre-schedule all of our advisory committee meetings, and we meet about quarterly in advance. But I think the main thing too is also really just keeping an open line of communication. So make sure they're included in any planning communications, any meeting invitations, even if they aren't able to attend them, they still get the emails and they still follow up and they still engage with us. I think too, especially in terms of creating messaging and, you know, really leaning into the oral health literacy, I think really getting their input on things as well in the information you disseminate really helps to increase that participation, because, you know, they not only volunteer with you, but they also have now a stake in the messaging that is disseminated throughout the community. So that really forms a little bit of a stronger partnership, we feel, by really making sure that their input is valued and included.
Great, thank you. Do Sutter or Shasta have anything you want to add?
Yeah, we can add. So something that we really saw that worked for us was that we did that initial visit where we created a champion at each site. So we just kept track of who our main champion was. And that didn't necessarily have to be the dental provider. It was, you know, sometimes it's one of the receptionists or the dental clinic manager, and having that person, you know, that selected person in each dental clinic really helped us because they knew who we were. They know our names. They know us by faces now. And I think that contacting that same exact person and speaking to that same exact person really helped build that partnership and that relationship, because anything that we had for the whole team, they were just able to share on our behalf. And it's funny because one of our children's clinic that we visit, like they know us. And when we walk in, they'll be like, hey, Tammy, hey, Ree, hey, Christina, like they know us. And it really makes us happy that we were able to build that relationship and that comfort level between us and the clinics. So I definitely recommend creating champions at each site, just like you are doing with your COA, and champions at each school district.
Great, thank you.
And I was just gonna, sorry, it's Christina from Sutter. I was just also gonna say that we do like to visit our clinics too, and like Rhea was saying, we love to make sure that our champions are staying connected with us and we're staying connected with them, and we would love to see how we can be of assistance to them. And it's definitely great having the oral health committee as well. And we love meeting we don't meet quarterly. I think we meet, is it quarterly, Rhea? I can't remember now, but we love meeting with them, and we just love making sure that we stay connected and grounded with a lot of our dental clinics and partners.
Yeah, it was quarterly.
So when you guys are going to the offices, are you setting, how do you do that? Do you tell them in advance you're coming? Do you just drop by? How do you, when you go to the dental office, what's your tips?
Yeah, so sometimes we just strategize for the year, like what we want to do in the dental clinics, and then we just stop by. So, for example, just recently was Rethink Your Drink month, so we kind of like, thought about like what do we want to do with the clinics this year for Rethink Your Drink month, and then we came up with a pitcher infused water. We've done that in the past as well, where we collaborated with our CalFresh Healthy team, living team, and they provided like the fruits and stuff. But this year we wanted to not give them recipe that they should do and let them choose what recipe they wanted to do. So that really helped. And then other times that we've met just depends on like do we want to give them, like if Smile California comes out, let's say, with like a really cool brochure on sealants, then we take that to our advantage and say, you know what, this would be a great resource for our dental clinics to give out to the parents. So that becomes another reason for us to just check in with the clinic, stop by, give that material to them to put in their toolkit box. So that's kind of what we do. And then, of course, through email and through our health advisory committee, we invite all of them. And then, like I said, we're hosting our National Tooth Fairy Day event here in August. So we're constantly in touch with them, emailing them, asking who wants to volunteer at our next event, at the Haunted Health Fair event that we have for Public Health Week. We have these different events at our public health department that we open up to dental providers to come to either do screenings or apply fluoride. Some of them are willing to apply fluoride, or just come and market their resources that they have available. So yeah, we just stop in. I mean, it doesn't hurt. And if they're busy, they're busy. You stop in another day, or you make an appointment, you know, through email or something.
Great, thank you.
Yeah, you're welcome.
I want to see what's in the chat. If someone wants to read off any questions in the chat, we'll spend another minute.
Yes, so there's one from Andrea Linder that says, how do you pay the RDHAP? By site, day, or by students seen?
Do you guys go ahead?
So for our RDHAP, currently we pay her hourly, and that was based on the recommendation of our contracts team of how our county would like prefer to compensate her. So it's by hour, and basically what she does is we go to the school and we complete, like, for example, screening the number of students that are there, and then after that she invoices us, and our fiscal team pays her that way.
Great, thank you. And then she also has a follow-up question. Would you share what daily rate you pay?
Yeah, so right now it's not a daily rate, it's an hourly rate. And that hourly rate is high because she does have to pay insurance out of pocket. So because of that, it's $150 an hour.
And then we have one from Melissa Cardenas, which could be like an average of what the usual range of daily pay for those that get daily. I know you've mentioned hourly, but if there's like a daily range.
For a daily range, I'm sorry, I'm not familiar with what the range would be for that. So usual range of daily pay. So yeah, it would depend on the number of hours. Usually, because of the school schedule, we usually spend 4 hours at a school each day. So we try to finish around lunchtime. So we usually spend 4 hours. So given 150 times 4, that would be $600 a day. And that would be to screen all the kindergarteners. And then to respond to Andrea's question about travel time, yes, we do pay for travel time because we consider all of it under like the RDHAP's work for completing the COHA assessments.
I know our Marin County representatives have to leave. I wanted to give them a chance to say one last thing if you have anything else you want to say. Otherwise, we will thank you guys for volunteering your time to share today.
Yeah, just if anyone has any questions, I'll put our emails in the chat. Feel free to reach out. But yeah, kind of speaking to the last questions, what advice do you have for other LOHPs? I would just say, just really lean into anyone that is willing to really participate and support the local oral health program. I mean, outside of the FQHCs and dental societies, we do have partnerships with organizations and teams that aren't necessarily oral health related, but we've had some really wonderful partnerships flourish with that. And we've created some really wonderful oral health programming that involves oral health literacy and messaging with that as well. But I would say just definitely lean in and, you know, partner and get advice, input from any of your FQHC partners or dental society or other organizations as possible. I think that really helps build the foundational partnerships. Sarah, I don't know if you wanted to add anything.
I would just say, maybe just to think about what helps us in our partnerships. You know, how do we feel better connected with other programs? And at least for us, we've identified having activities that we can invite them to and to participate in. Like many of the panelists mentioned today, you know, consistency, like regular communication, and yeah, I mean, we're grateful for them, and they know that. We always like to tell them how grateful we are for their partnerships, because they help so much. I mean, they're directly working with the community that we're regularly trying to do outreach to. So yeah, I would just say trying to find ways that you think is helpful for your program, and trying to implement that in your relationships with your dental partners.
Great, thank you. All right, so I'm going to go ahead and save the rest of the questions. I appreciate everyone for putting in your comments and questions in the chat. We're going to save them because we have time set aside for additional Q&A at the end, and the other two panelists are able to stay until the end. So I'm going to go ahead and move on to our next speakers. But I want to thank our LOHP panelists again for sharing some of those great tips. So our next, I'd like to invite Cindy Smith and Amina Jones to join us and share about their work with Medi-Cal Dental. Cindy is a member relations representative, and Amina is a provider relations representative with the Medi-Cal Dental outreach team. So please go ahead and tell us more about your work and how you are resourced for the LOHPs.
Thank you. So the map that you're seeing on your screen right now, California is divided into 5 territories, and each territory has a member and a provider outreach team member. And we work very closely as a solid team. I say that because there's been some movement within the team, and the map that you are seeing will have some changes on it, and that will be published soon. But in the meantime, you can reach out to any team member that you see on this map, and you will be assisted immediately. I am currently supporting member outreach, and we are currently working with various oral health partners and organizations to assist members to understand their dental benefits and to increase utilization. We implemented a mobile dental van at the end of last year, and that has been touring some of our more rural and underserved areas to provide exams and cleanings to our Medi-Cal members. And our current promotion is called Sealant for Healthy Smiles, and the kickoff event for that will be at the end of July in Sacramento, and you will all be receiving more information on this promotion very soon. So now I'll hand it off to Amina, and she can share a little bit about provider outreach.
Hello, everyone. For the provider outreach, what our focus is to actually get out into the communities and recruit providers. In that recruitment, we're of course explaining the benefits of the plan and how it can best serve the community. And this is for all of the counties that you see listed here. And we especially focus on those that are underserved as well. We also assist our current providers with any questions that they may have, whether they're affiliating or associating a new rendering provider, have questions about opening an additional practice, and then also helping with enrollment questions with the new state implemented electronic enrollment platform PAVE. We're also focusing on recruitment now throughout the counties for specialists, because there is a great need for that throughout the counties. Also, we do a lot of border state recruitment. So that includes both Nevada and Arizona for the counties that are higher up close to those borders. And that's pretty much what we do, hoping to build building the network for our Medi-Cal members.
Great. Thank you, guys. So I wanted to see if Cindy could speak just a little bit about, I know you've worked with an LOHP before, about they approached you saying they were having not enough providers in their area. And can you just tell us that story about what happened and what you were able to do? Just to give an example of how LOHPs can utilize some of these resources and these outreach reps.
Yeah, so that was a little bit about the dental van. It was Humboldt County, and they were really struggling with providers. And so we contracted with Smile Dental Services and took his mobile dental van to Humboldt. And we've been up there a few times. We'll be up there again next week, and able to provide dental cleanings, assessments, some basic restorative services, and really just trying to get some of those members, especially those that are in pain, out of pain as quickly as possible.
Thank you. I'm sure people may have questions for you guys at the end, but we're going to go ahead and go back to some of our communication topics in just a second. So thank you both very much. All right, so I wanted to also mention, when you guys are working with dental partners, sometimes you might want to be sharing resources with them. So I just wanted to highlight 3 that we have on the COTAC website that you might be interested in. This first one is the First 5 California kit for new parents. This QR code will take you to a lunch and learn that was done about the toolkit in the fall, and you'll be able to get much more in-depth information there. But the toolkit includes oral health information, including age for first dental visit, how to find a dentist, young child oral hygiene, both for babies and toddlers, the squirmy ones. It also includes a finger brush as part of its materials. And if you guys, anyone's going to the Oral Health Summit next week, we have a few sample kits there, and we'll have some information about ordering. And we'll also have ordering information as part of the resources that go out with the materials from this session. The other resource that we have is tobacco cessation. So we have the tobacco cessation toolkit for California dental providers, as well as a tobacco cessation webinar available for dental providers that provide CE. And these are available on the COTAC website, and it's part of Objective 4 of your work plans to be sharing tobacco cessation resources with dental providers. And then the focus of today is the Oral Health Literacy Toolkit, which aligns with Objective 5.2a to develop action plan to support and sustain an oral health literate workforce. And as you all hopefully know, we have additional resources on the COTAC website. So if you want to partner with Rethink Your Drink, like some of the previous panelists have mentioned, we have resources for that and many others in our resource center. All right, so we're going to now bring Anthony back to talk about improving oral health communications.
Yeah, hi, I just put this in the chat, but I did want to add that the kit for new parents is free to everybody and can be ordered in bulk. So it is a good resource. One of those pieces our team at HRA developed and have been developing, I don't know, 2 decades now. The first one of which was done in conjunction with Rob Reiner and a series of videos that were popular for a long time. But have ceased production. So now there's just the kit and the booklet, and they reach, I don't know, 250,000 new families every year and convey a lot of important information. Earlier I mentioned that the definition of OHL has evolved over the years. And I just wanted to make sure it's clear that there's a reason for that. The original put all of the burden on individuals, right, to understand and act on health info. and that the newer definitions, both for health professionals, health organizations, and society in general, they recognize obviously the role the rest of us play. They suggest that the burden should be shared, right? That we as professionals who are part of organizations also need to improve our ability to communicate well. In fact, I'd argue that as health communicators, our role and our principal role is to help others understand health information, period, and preferably the first time they hear it or read it. Next slide, please. But of course, doing that is not always the easiest thing. And the way we think about it is that we ourselves are trying to develop oral health literacy skills. And the short answer to how to do it is simply practice. Health literacy and oral health literacy is like any written or oral practice. It's a craft, and the more one does it, the easier it gets, the less time consuming it is, etc. So for the rest of the session, we're going to be discussing some methods for improving how to communicate oral health information to people who have limited health literacy skills. These methods that include acquiring knowledge of your audience's needs, developing an approach of cultural humility, and honing our communication tools, such as using plain language and engaging whenever possible in teach back. All right, next slide. Thanks. The first step is to take what's called the universal precautions approach. And it is to treat everyone as if they have limited oral health literacy skills. This, of course, helps reduce errors and ensures you're not leaving anyone out when you're conveying information. So some organizations struggle with this idea because they think oral health literacy is just for some groups of people, right? And that most people understand the health information they receive, and furthermore, might even be offended by the use of simple or plain language. But as practitioners, we would urge everyone to think about just how many disabilities are invisible, right? The truth is we don't know what someone's barriers to understanding might be unless we know them well, but even if we knew them well, we might not know. And the other factor is to consider, just from our own personal experience, that what we do as health communicators is basically providing instructions in some level, right? How to brush your child's teeth, how to access free care. And the question we ask ourselves a lot is like, is that any different really from, say, putting together a child's dresser? We think the answer is really not by much. And if you think of it in those terms, it's pretty clear that it's easy to agree that easy to understand instructions for sampling pieces of furniture, say, are better and less time consuming for everyone, regardless of how much money they make or how educated they are. Because in the long run, even highly trained medical professionals want clear language, easy to use design, and simple layouts, et cetera. So, and the data as well as experience confirms that people rarely, if ever, feel condescended to by health literate materials. Next slide, please. So getting this back to this idea about audience, earlier Danica had mentioned this idea of partnership, right? And involving, creating more stakeholders, creating buy-in with our partners. And really that's the root of health literacy. It's founded on the idea of, or the model of participatory design, right? We want people involved. We want to understand what their needs are. We want to ask them what their needs are. We want to know, how best to serve them. And again, so, we're trying to think about, with who we are communicating, we're trying to think about their main concerns, but I think importantly too, what their daily life is like and what questions they'll have about whatever it is that we're trying to convey, right? So asking these questions that really help us not just conceive, but refine whatever it is that we're trying to communicate and help us generally kind of communicate whether verbally or through, written communication effectively. So one way that we can begin to understand the needs of communities is through the practice of cultural humility. This is going to be a very brief primer on what that means. This is a complicated concept that takes a lot of practice and education and certainly more than a few slides can convey. So we're just going to give you the very high level version of this. So cultural humility is an approach, for those of you who don't know, to interacting, communicating, and serving people from backgrounds other than our own, right? And it's based on the premise that we can never really know another culture and that many factors shape a person's beliefs, values, and behavior. It asks us to accept that we're learners, right? Which is not always something that's easy for people who are used to teaching others, and that we're not experts when it comes to other people, and to give a good deal of thought to our own attitudes, and beliefs, however thoughtful and caring we might think ourselves. It also asks that we recognize the potential power imbalances between ourselves and the people with whom we're communicating, and accept that learning about the cultures, thoughts, beliefs, and experiences of others is an ongoing process. Next slide, please. So you can put this approach into practice in a number of ways. For example, you can ask if there are any aspects of personal identity or cultural background that might be important for you to know about. You can provide a humble self-assessment of your own familiarity or lack of familiarity with the identities mentioned and ask if they would tell you more about what those identities mean to them. You can also acknowledge any discomfort and thank them for helping you understand their personal experience. Lastly, you can ask them to make you aware if you ever make any inappropriate statements or assumptions about their experience or identity. Again, this is, challenging stuff for even the most skilled, I think, of people with high interpersonal skills, and it's it takes a lot of practice. But let's say, we were just trying to do something really basic, like convey a simple health communication, whether written or verbal. Starting from this place in our mind is going to get us a lot of the way there. Okay, so this is sort of the conceptual ideas of oral health literacy, but we really want to make ourselves more easily understood, and there's some strategies for doing so. For example, the primary ones are using plain language, and that sort of includes avoiding or explaining jargon, as well as acronyms, and using teachback. And teachback, for those of you who don't know, is when you explain or demonstrate something and then ask your listener to explain it in their own words or demonstrate it back to you. We'll go into a little more detail later on about each of these, but especially teachback. I do want to mention too that there are lots of strategies that one can take. These would apply to written communications, but today we're really kind of focused on oral communications. Written communications would, include a whole host of other strategies around informational design and hierarchy of information and that sort of thing. And there's a lot to go over in those topics, but today we're really just going to focus on a few really core ideas. Next slide. The first of which is plain language, and to drill down on it, it may be the most important, right? So essentially, plain language is sort of synonymous with health literacy and health literacy techniques, right? So, and when you read about it somewhere, you may notice that the subject is not actually always about or solely about language, but just sort of how you craft information in general. So at HRA, we look at plain language and then informational design and other stuff as separate topics. So today we're just going to keep plain language on the topic of language itself. So the words you choose and the order in which they appear. Really simple and straightforward. Because there are a few kind of important points on this that we should make about using plain language. Because the term itself is a bit deceptive. There's a common assumption that one should just kind of know what is and isn't plain language, that it's sort of inherently obvious. But in truth, it's not always so clear. For example, we might assume that monosyllabic words are always plain and understood, while polysyllabic words are always complex and therefore not well understood. But there are plenty of times where that isn't the case. Take the word vial, V-I-A-L, though it's short, and seemingly well understood, or might be well understood or clear. Saying small bottle would probably reach more people. It is more clear to more people, I should say, than the word vial. And so it's worth thinking about the words you use. Also, plain language, I would say, we kind of indicated this before, but it doesn't really mean dumbing down, right? We still want to communicate all the most important information, but including all the technical terms. We just want to do it as simply as possible. And one last point is that, and this is something that I think as people who, again, create communications, it's really common to kind of be guilty of, and that is to rely on grade level when it comes to plain language. So therefore, 5th grade level means it's plain, or 6th grade level means it's plain, but in truth, it's while it's an important indicator, it's not the only one. It can be really misleading. So you find, first of all, for those of you who don't know, grade levels were developed around World War II to determine whether or not people were kind of suitably intelligent to enter the military, determine where they would go in the military, et cetera. They were very, very basic. And even though they've evolved, since then, even the most complex one is still pretty rudimentary and can be very easily gained. So you could quite simply have a 5th grade reading level material, or just your own diction, and it be entirely gobbledygook. So it's not the best barometer. Really, what we want to do most of all to ensure we're using plain language, and if we move to the next slide, please, is to try these 3 things. And the most important is to simply use everyday words whenever possible. Right? It seems almost fatuous to say, right? Simple everyday words. It's not that easy to choose those words, but really, if we think about it in those terms, it'll be easier to discover in the moment or whenever what we mean by plain language, and what isn't meant by plain language, right? So another thing is we want to avoid or explain jargon and acronyms. Happened just on this call a few minutes ago. Someone mentioned one and didn't even among professionals, it didn't occur that not everybody knows that term, and that happens all the time in so many forms of communication. So it's really important to learn how to spot that, and we'll do a little bit of it in a minute. And the other is to give context about whatever it is we're communicating. So one of the things that we think about a lot is that people are coming to a conversation or say a brochure or whatever it is with a number of barriers to understanding, right? They have those barriers, and you could add to them very easily, right, without knowing. And one of the ways you can do that is by not kind of calmly and slowly leading people through whatever it is you're trying to communicate, and instead kind of pushing them through, right? And so giving context helps lead people through whatever information you're trying to convey. I know it's a little vague, I'll show an example of it in a minute, but really it's just a matter of like stating simply and declaratively what it is that you're trying to talk about, the topic, right? Think of it as like a topic sentence or something like that. Very, very simply just communicating what it is that you're trying to convey. So as mentioned before, that health literacy is like any other craft. It takes time and practice, but there's always sort of a basic approach that help others understand what you're saying. And the simplest is to simply, substitute longer words for shorter, simpler ones. So obviously you want to think about the words that you're using or that you might use and replace or explain them. And the reason why we have this list up here is we want to indicate to you that some are very easy to spot. So if you look down this list of the longer words, words such as febrile and geriatric are pretty easy to say, okay, those aren't well understood or commonly understood words. But then, there are others that we would probably assume are pretty easy or well understood, such as determined, physician, and approximately. But for many people, those aren't simple everyday words. And even if they are somewhat understood, we have to think again about the kind of barriers we're creating, right? So if we give our listener or our reader pause or make them do unnecessary work, it may mean that our message gets completely lost, right? And I think about that too. Once you lose the thread, maybe you don't ever pick it up again in the conversation, and then it's difficult to admit that you've lost the thread, right? So there are lots of these kind of dynamics during an interaction or in a material where we really want to think about the language we're using. Again, give a lot of thought to those words. Choose simple ones whenever you can. Just try not to sacrifice accuracy or meaning, and just in order to find an easier word, simply go with the simplest language. Define it. And the thing I would say too is use as many words as you need to make the message clear. More words and simple is a good deal better than fewer words and complex. So I know that's probably counter to everything everybody read in, say, Strunk and White or in general English courses or anywhere, anything that tells you about writing, fewer words, the better. Well, not always. Sometimes things need to be explained and it just takes more words to explain them. How you explain it makes all the difference.
I want to give like a 5-minute warning, Anthony, time-wise.
Yeah, okay, then we're not going to get through everything, but okay, so just a quick example of that here. Let's see if we can, if those of you want to participate in this here, just to replace a somewhat complex word in the chat, feel free. The word here is advocacy. Again, we're just trying to find some solutions for longer terms. This is one that, you know, we might consider kind of middle of the road in terms of complexity, but it might be difficult for many, many people. Give everyone a few seconds to do that. Support, yeah, that's great. Sure. Yep. Brianna and Monica have support, and at least Alyssa has recommend, inform, and educate. It's real good responses, right? I mean, and you know, the important thing too, I want to stress is like none of the solutions that anyone comes up with will ever be perfect, right? There is no formula, there's no perfect way to speak clearly or to communicate clearly. You know, there's just being understood or not being understood, and it's our jobs to really determine whether we're understood or not, or as well as we can anyway. Yeah, those are okay. Promote, sure. You know, again, it's an idea of like using. If you can go to the next slide, please. Using, you know, as many words as you need to. Something as simple as this help to get you something that you want or need, right? Is one way to do it. All the ways that were suggested are also good. But again, it's something that we want to think about. Next slide, please. I'm probably going to skip through this, but you know, we're going to do another one with chronic disease. We can move to the next one as well. Just a quick view of it. Yeah, again, so a health problem that can't be cured, that goes away and comes back. So I want to move on to the next slide then, since we don't have a lot of time. You know, another way to think about, I'm going to talk about this briefly a second ago, but another way to think about this, to think about communicating clearly, is to think about making listeners feel capable, right? Say of making a dental appointment or asking for care, making lifestyle changes, whatever. And the fact is, mysterious words work against that feeling of competence, as I mentioned before. So jargon, and jargon is sort of just that to most people who don't specialize in a particular topic. They're mysterious. Again, most people don't want to admit it when they don't know what something means. And I would urge everyone to think about the last time you asked someone what a word you didn't know means, instead of like nodding along and checking the internet later. I mean, it's just a completely common experience, right? But when you're in a medical situation, it's not easy for a lot of people to admit that or remember what was said and check it later or any of those things. But a lot of people leave those situations, those health interactions, let's call them, certainly with doctors, the stats are like 50% is not remembered, so, or understood. So again, we want to explain jargon the best we can. We don't want to set up an in-group and out-group, which is what jargon does. We want to create a large in-group. All right, so moving on to the next one. You know, I think since we only have 5 minutes, I think we're going to skip all this. Maybe if we can go down to the teach back section. Unfortunately, we're a little short on time, so
I think we can take 5 more minutes starting from now.
Okay. So just maybe go to I guess we can go to this quickly. No, I think we should skip the jargon and go to give context if we're going to get through.
Yeah, so people know these slides will be in your materials. So if you want to, there'll be more, it's just some examples of different
just some examples.
words. All right. Do you want this or the next?
Yeah, that's good. Sure.
Okay.
So again, we're just trying to this idea of giving context, right? Of not creating barriers for people. We're really just trying to start listeners with why they should pay attention to our messages. And we're trying to put the why where we'll make them the strongest impression. So we're just trying to let the listener know, that this is important, this is why it's important, etc., and just lead with that, and then we can follow up with it. So an example of that is the next slide. Yeah. So here you can read, it says, to keep your baby's mouth healthy, you'll need to wipe their gums after meals. So there are a few things to say about this. And again, one of them is that it's not a sentence structure that we would normally consider like the most health literate, right? There's a subjunctive clause, the payoff comes at the end, so people have to wait for the payoff. etc. It sacrifices simplicity, but the thing is it adds meaning and it does convey important information. But again, I want to stress there's no formula. Your judgment and experience in explaining health information is going to matter a lot, especially if that person is right next to you. So knowing, what you can say and what you can't say, and then also checking whether or not it's understood, as we'll see with Teachback, will help a good deal. Next slide, please. We can definitely skip this one. I think everyone on this call probably understands the concept of choosing the right tone while talking to people, but the basic idea is to, use a friendly tone and be as warm as you can when communicating with anyone. All right, so Teachback. For those of you who don't know, and I imagine there are very few, Teachback is a technique to ensure effective communication. Essentially, it's when you explain or demonstrate something to a community member, you ask them to explain it in their own words or demonstrate it back to you. Very simple. So the idea is that it helps confirm understanding, and just importantly, it shows you how well you explained or demonstrated a particular concept, right? So, and then if necessary, you would then reteach the information and repeat the Teachback process. So next slide, we'll go over some techniques, how to do that. So the simplest and most straightforward approach to Teachback is something called thump and check. Maybe something that we've heard in dental offices and medical offices and whatnot. It's basically that one organizes the information one wants to say into smaller pieces or chunks. And once you explain a chunk, you essentially ask the listener to explain it back. Right? And then if they can't explain it back clearly to you, you move on to the next chunk. However, if they don't seem to understand or, are a little unclear about what you said, you try to explain it again, perhaps in another way, and then check once again by asking them to explain it again. And essentially you do this going through the various chunks you've set up in your mind to the end until the listener understands what you've told them. So it's just a way of, kind of breaking up the information into smaller bits and then checking at every stage to ensure that your listener understands. Next slide, please. So, again, many people probably already know what Teachback is and are using it and understand the concept well, but it directs that one can always improve, right? Again, practicing any communication skill goes a long way. So we do want to provide a few tips for helping you refine your approach. And the first is to show that you're listening. So friendly facial expression and tone of voice can help put people at ease, right? And indicate that you're not judging them, whether they understand or not, right? Obviously, the other is to use simple and clear explanations, give only a few messages, and again, try to use the plainest language you can. And then, when you ask the patient to demonstrate or explain, to be gentle, right? So consider saying something like, we've gone over a lot of information. I want to be sure that I explained everything clearly. Please explain it back to me in your own words. And there are lots of more suggestions in a toolkit. For those of you who haven't looked at it yet, there's a Teachback booklet, and there's some in the guidebook as well, just about kind of navigating those conversations. And again, if a listener has some difficulty teaching whatever it is back to you, don't put it on them to say sorry or anything. You could apologize, right? To kind of pave the path for that. Apologize for not being clear enough, and then just try to explain it again in a simple and clear way. Again, it's about putting yourself in a position of trying to understand what that person needs in that moment and making sure that they're getting it. All right, so next slide. We just have some phrases here. Again, these are in the booklet as well as elsewhere, and you can read them for yourself, but I guess I'll go with them just really quickly. But I think we said that first one. So the second one, I want to make sure we're on the same page. Could you explain this to me? Will you tell me how you would like to explain this to your partner, how you would explain this to your partner or family when you get home? I know we discussed a lot just now. It would help me to know if I'm being clear, if you could tell me what I just said, et cetera. It's just along in that vein, just in those conversations. So that is, I think, the bulk of what we wanted to, and we're just at time, I think. I think there have been some questions.
Perfect. Thank you so much.
Right, of course.
Our contact information will be included as part of the materials that go out.
And Chris, I just wanted to add, I know you mentioned it before, but again, talking about participatory design, the toolkit itself was developed in conjunction with dental and oral healthcare providers. And a lot of what you see in there is the result of their input and their needs, them telling us, for instance, just to go into a little more detail about how it was developed, it's based pretty closely on the AHRQ toolkit, which is a larger medical oral health literacy toolkit. And that toolkit is, the guidebook anyway, is 160 pages, more than that. It's enormous. And one of the things that we kept hearing from dentists was, we don't have a lot of time. We have no time. We have absolutely no time. So we really try to streamline things as much as possible. And one of the kind of tropes of the toolkit, and I think in health literacy generally, is that any little improvement that one can make, or the dental office can make, or that an individual can make, goes a long way, right? And you don't have to solve all of the issues. You don't have to develop all the skills all at once. You could just take any little part of it you like, make a little improvement, whether in your own communication skills or your organization's approach to communication, and that will have an effect on the people you serve. And thanks.
Fantastic. Yeah, thank you so much. I really appreciate that. And I appreciate all of you, all the panelists, and Amina and Cindy for being with us today and sharing. We are close to time, so I'm going to go ahead and launch our evaluation poll. But if you have questions, please add them to the chat and we will continue chatting as long as you stay on. So our evaluation poll is launched. Please go ahead and share your feedback. And I'm also going to put our qualitative survey in the chat box. I did see one question that came through for the Sutter team to clarify and elaborate on the Tooth Fairy event that your county hosts and how your dental partners are a part of that.
Hello.
Hi.
Hi. Yeah. So basically, this event that we have is actually through our Oral Health Advisory Committee, like I said, and it's just an event that we created together, and we discuss like who we want to see at the table, like that day. Who do we want to see at this event? And we kind of like just open it. We plan it and we see like how many people we want at the event. We open it up to the dental providers to see if they are interested. And majority of the time, like all of our dental providers are interested on attending as long as they have an open schedule that day. So basically, we're having 5 dental providers come. One of the dental providers will be doing free oral health screenings and COAs for school-aged kids, and then the other ones will be all assigned a topic. So one dental office will talk about the importance of sealants, but also provide their services, resources, and materials. And then one would be 2x2x2 roll. One would be talking about sealants and such. And then of course the toothbrushing and flossing demos. And then besides the dental providers, we are inviting like CalFresh team to talk about the effects of eating like nutritious foods for your teeth. And then, of course, our tobacco control program would be coming in talking about the effects of tobacco use and how that causes, the effect on your teeth and all that. So we're trying to make it all oral health related, and have fun activities for all the kids and parents to do. And we're going to be holding it at one of our really popular sites, which is our local library. So it's going to be indoors, away from the heat. And yeah, so it's usually a good turnout. This is our 3rd year. First year we did at Sutter. Last year we did at Yuba County because we are bi-county. And then this year again, it's at Sutter. So that's kind of a little bit about the Tooth Fairy event. I know we're out of time, but if you're more interested on like the, how we do it, what themes we use and all that good stuff, you can email me independently and I can talk a little bit more about it or call me.
Great. Thank you.
You're welcome.
Yeah, and there's rich discussion in the chat about RDHAPs and the logistics of getting them to contract and partner with you. So feel free to scroll back through and look through there. But yeah, we are actually 1 minute over, so I think we're going to have to end it there. But you guys know how to contact us, and we can also connect you to any of the speakers today if you have additional questions. But thank you so much for joining us. And again, thank you so much to all of the speakers who were with us today. We really appreciate all of your expertise.